I got a clinic where most people have failed everything type story, and I've learned to get exceptional results inside that patient population, the medical mystery population for orthopedics. So I see what the medical system is missing. I have like 1,000 pages of maps of the body, and my introductory shoulder course, I offer a money-back guarantee. If you cannot relieve the pain of the majority of the people that you attempt the method on, you get a full refund, and boom, the pain is gone immediately, and it says no evidence of sacroiliitis on the CT, X-ray, or MRI. So I do not believe that is any use to have that done. And like a lot of my patients have been referred to psychiatrists that didn't need it because they had something that didn't show up on the X-ray and MRI, and then they said that we can't be crazy, patient's crazy, making it up, psychosomatic pain. But in reality, they had something that didn't show up. And she said the last therapy I went to for my groin pain, which is one of the most common referred pain patterns of SI joint, laughed at me. And I was like, yeah. And then I open up her SI joint, realign it, upslip, outflare, and boom, her groin pain's gone. Hey everybody, what's up? Physical therapist, Dr. Whelton, coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I got a clinic where most people have failed everything type story, and I've learned to get exceptional results inside that patient population, the medical mystery population for orthopedics. So I see what the medical system is missing. And I've published papers in peer-reviewed journals. I've published root cause of SI joint dysfunction, root cause of plantar fasciitis, root cause of sacral torsion shear anterior sacral tilt. I've also published a paper on impingement syndromes of the shoulder. And I outline how I get the results that I get. Free, go and please use them. I've developed diagnostic methods to be able to help people diagnose. And then I also have my online courses, which I put all of my protocols in there. And my Rehab Results online course, which is all my orthopedic protocols. And then I map the body, 1,000 pages of the maps of the body, where like you would stimulate here and it would shut pain off here. But if you turn your hand over like 5 degrees, it doesn't connect anymore. It would connect over here. If you go like that, it would connect in here, that. If you go like that, it connects down here, that, up here. You don't have to know that. I mapped it. I have like 1,000 pages of maps of the body. And my introductory shoulder course, I offer a money-back guarantee. If you cannot relieve the pain of the majority of the people that you attempt the method on, you get a full refund, no hassles. So anyways, I get that. And then we got my sciatica cervical ridic immediate relief course. And then I have my membership group. So you can join my membership. Go to wheltonmethods.com. Everything is on wheltonmethods.com. You can join my membership, and I'm doing a live community I'm creating. And it's going to be a community of people where I teach something basically weekly, but then also you can bring in your tricky patients and I can help guide the diagnosis. And we can all learn and do a plan of care, and we can follow that patient through. It's going to be really cool. My goal is to get people on point in diagnostics and learn how to rule things out to get to, through deductive reasoning, to get to the only diagnosis really it can be, because that's how I do it. So anyways, so in this clinic where most people have failed everything type clinic, I see what the medical system misses. And what they're missing that I find is mechanical issues, things that don't show up on x-rays and MRIs. SI joint, sacral torsion, sacral shear. They say that they image that, but I do this. I have basically an SI joint clinic. Most people have 2 to 3 issues, but the main reason is severe pain that people can't stand up, that kind of thing. And I have looked at CT scans, x-rays, MRIs, and I've zoomed into their SI joint. Looks in alignment, right? And then I go over there and with my SI protocol, read my paper, root cause of SI joint dysfunction on my website, wheltonmethods.com, and I have them put my thumbs on their PSIS, and in the paper I outline, I have them extend back, and one thumb translate superiorly and the other one inferiorly. The person had an upslip, I pull it back down, and I lay them on their side, and I gap open the out flare, because that's what I detail on the paper, SI joint, caused by an upslip and or out flare, and boom, the pain is gone immediately, and it says no evidence of sacroiliitis on the CT, X-ray, or MRI. So I do not believe that is any use to have that done. This needs to be clinically screened, and I published it for free, wheltonmethods.com. Then I have, so I see SI joint, sacral torsion, sacral shear. That's the main cause of back pain that I see in here, especially in the patients that have failed everything. And then I see, what else do I see? I will see rib head, costovertebral issues. Those people, they get x-rays, MRIs, nobody can figure anything out, or they'll say it's a bone spur, but I just do a simple rib springing or hug them like that and hold it there, boom, their back pain's gone. The sharp pain they had in their back. Sharp pain is usually mechanical pain. And I find, so I see that. And then I see capsular issues, joint capsular issues, like in my plantar fasciitis paper, I outline in that. I do not find plantar fasciitis to be a foot issue. It's actually an ankle issue. And specifically a tight posterior capsule. Check your patient's posterior capsule of the TC joint, and you should see what I outlined in that paper, that, and how to get it better. I see what are called stress injuries. What I call stress injuries, which are generally that I see in here after everything's rolled out for, headaches. I mean, there could be brain tumors, all that stuff. But when nobody can figure anything out, I see migraines, that it's a C2 misalignment. But the question is, why does it get misaligned? And the answer is, well, what's pulling on it? Well, the muscles. Okay, great. So you massage the muscles, but it continues to happen. My question has always been like, what's the why behind that? And the why behind that is the nervous system. So I calm down the nervous system, and then the muscular system relaxes. So anyways, TMJ, that's been ruled out for like AVN, avascular necrosis, a disc issue, and the person's, stressed. And then I see neck tension, people that are like, oh, my whole neck hurts, that's stress related usually. So I see that. Now, the one thing I want to talk about today is joint capsular issues for hips. Now, I've seen this a bunch of times. These people, first I rule out their SI joints. Okay, so I rule out their SI joints. So these people come in and they say that they have pain in the hip and in here, in the groin region, right? Nobody can find anything on x-rays, MRIs, that kind of story, right? So I make sure that I rule out SI. So I put my thumbs on the PSIS, have them extend back, boom, one thumb goes up, the other one drops down. That tells me they have an upslip on that side. I pull it down, read my paper, I pull it down, and then I layer them on their side, and I open up their out flare of their pelvis. Sometimes you just can't get it open, so I put a ball between their knees and standing, which goes like that. After you get the upslip, you got to do the out flare, but you got to get the upslip first, okay? And then sometimes I just add a little overpressure to it with the ball squeeze and standing. And I would ask them, do you still have that groin pain? And if they say no, then I just confirmed it was SI that was causing it. But if they say yes, then I start to look for other reasons, even though I push harder, I make sure it's not SI that's stuck and I'm missing it, But specifically, I have seen patients with groin pain and hip pain. Now, I rule out SI, and they're not advanced in age, 60s, 70s, 80s, something like that. So it's not arthritis. And they've been like 40s, 50s. Now you can start to get arthritis, especially if it's genetic, you can get it in there. But these people didn't have it. And I started to, so over the years, I started to see these people. They were like medical mysteries, but they would have this groin pain, right? And hip pain. And what I would do is I would put them in a 90-90 test. And when you do that with them, that you go like this and like that, and they'll have like 5 degrees of range of motion. And what you're dealing with at that point, and you can check the other motions, but what you're dealing with is a hip joint capsular contracture. Okay, so the femoral acetabular joint, ball comes up, comes right in here, and it went like this. Okay, and what happens is you just grab your hand and go like this and go like that and squeeze hard, and the joint capsule locked down. But what happens with a patient with arthritis, right? The patient with arthritis can get groin pain, right? They get hip pain, they get groin pain, right? Because the hip joint refers into the groin. But in these patients, they don't have arthritis. What they have is bone pushing on bone, basically, but due to a tight joint capsule. So it's just shoving it right in there, and they're getting referred pain in their groin. And when that happens, these people go everywhere, because I've looked at their x-rays and I'm like, yeah, there's nothing on it. But then I check their range of motion, and they got contractions of their hips or hip. And then I start manipulating, like moving around their joint capsule, and there's no play in it, you know? And I'm like, no, this person's locked, like on a scale of grading 6, 0 being fused, 6 being like they were just in a car accident, they lost all, like 3 being normal, they're like a 1, you know? And no wonder why they have pain in the groin or referred pain in the hip. It's because their hips are locked down, kind of like an arthritis patient, but with no arthritis. So I did another video. If you go to Whelton Methods on YouTube or Spotify or Apple Podcasts, I did another video on hip contractures and the secret to get them better that I found. And hip contractures, they take a while, but you can loosen them up. I had this pro baseball player one time, and he came to me for a shoulder issue. And as we rehabbed his posterior impingement of the shoulder, which I wrote in my paper, you can read on my website, wheltonmethods.com. I checked he asked me, can you help me with my hips? And I checked his hips, and he had this. He had this going on. He literally had 5 degrees of internal and external rotation. And I'm like, how are you a Major League Baseball pitcher with no internal rotation? In fact, or external rotation. In fact, when he did his windup, he couldn't go like that. He went like this because he didn't have the rotation of his hip. At the end of it, he could go like this. So with this patient, I realized I was dealing with a contracture. Now, 2 MLB teams tried to help him and were unable to help him. And I asked them what they did, and they said, yeah, they did stretches with me, and I did the exercises, I think he said 1 time a day or something like that. And I was like, yeah, no, I found that doesn't work, that what you're dealing with is an elastic band, basically, the capsule, and you need to stretch it 4 times a day, okay? And when you stretch it 4 times, you can't let it recoil. Now, you cannot jump right into 4 times a day. If you jump right into 4 times a day, you throw the person's back out, or their hips are so sore they can't walk. And so with him, it usually takes about 3 to 6 months, and you never let it recoil 4 times a day with an inner tube of a bike tire, kind of like in my plantar fasciitis paper, the Mulligan technique. I use an inner tube, and I do a self-Mulligan technique at home, where I have it, the Mulligan technique where the mobilization with movement, but they use an inner tube that stretches out, and they go through all the different motions and stretch all the different capsule aspects that restrict each motion, right? Just like in the shoulder. And with this patient, in 3 months, he had 45 degrees, went from 5 degrees to 45 degrees, internal, external rotation, and then flexion, extension, all of that. And his windup changed. He could cross over it like that, therefore, theoretically, increase coil. He could increase velocity. No wonder why he hurt his shoulder. He's all arm, He can't get that twist that you need, So when it comes to these patients, you always got to check their hip joint. So when the person comes in and you evaluate their SI, you got them on their back. Before I pull on their leg, a lot of times if I suspect arthritis, a lot of times I will just do 90-90 and I'll internally rotate and I look at their eyes. And if they look like they're going to jump, or they jump, you just locked everything out in there, and it's usually arthritis. But also, I'll just quickly go like this to make sure they have motion in their hips, okay? But especially I will do this if the SI realignment doesn't work. Then I start looking down. So I start here, the SI, and then I start looking into the hip. And I start to say, okay, well, maybe this is just a straight up hip joint issue, right? And, the person will have minimal range of motion that will require gradually building up to 4 times a day, stretching with mobilization with movement. That's what these teams were forgetting, was that, yeah, you can stretch it, but you've got to stretch the joint capsule. You've got to stretch the joint capsule. And if you don't stretch the joint capsule, then you're not going to get the range of motion back. Or maybe you do, maybe you don't. But if you do it this way, I generally don't have trouble getting orthopedic contractures better with people that give it their best effort. Obviously, it's a home exercise program. You got to do it. But with those people, that give it their best effort and follow their home exercise program, it's a joint capsule. You can stretch it. It's like a muscle. You can stretch it, It just takes a while, So you got to warn them what they're getting into. Okay? What I find in not just clinical but business is that if you don't warn the patient that they are getting into like a 3 or 6 month rehab with a contracture, and they think it's going to be some quick fix, they quit. You have to tell them what they're getting into, because if people's expectations aren't met because you didn't tell them, what to expect, if people's expectations aren't met or something happens outside of what you told them, the possibilities that could happen, like they could be sore in their hip, they could throw out their SI joint, something like that, then if that happens, then they blame you. You don't know what you're doing, and it's your fault. Trust me. I've been a therapist 20 years, and I've been in business 16 years at this point. And early on, I used to have this problem, but then I realized it was my fault. Like I wasn't warning them, and I didn't understand the psychology of the patients that, you just got to warn them about all the possibilities that could happen. And if you don't, then it's your fault. You don't know what you're doing. And then they quit, and then they suffer with it. Okay? So anyways, that is very important. But always screen the hip joint, the femoroacetabular joint. Always screen it. They could have a contraction there. If someone has 5 degrees of internal, external rotation or something like that, why would that happen? Sometimes it's arthritis if they're older, but if they're not older, then if they're in their 30s, then they have a contracture, And especially if they get the groin pain and the hip pain that nobody can figure out, screen the SI first. Use my evaluation and diagnostic method, wheltonmethods.com. I published a paper on it. It's free. And then start to look down the kinetic chain into the hip joint. Okay? Other than that, yeah, you just got to make sure, because the medical system I find in this clinic misses what doesn't show up on x-rays and MRIs. And if it doesn't show up on x-rays and MRIs, the patient's crazy, and like a lot of my patients have been referred to psychiatrists that didn't need it because they had something that didn't show up on the x-ray and MRI, and then they said that we can't be crazy, patient's crazy, making it up, psychosomatic pain. But in reality, they had something that didn't show up on an x-ray and MRI, like SI joint dysfunction. See that all the time. And if you read my paper on SI joint sacral torsion shear, 57%, I wanted to put that in there so people would see what I'm seeing in here and take this seriously. But 57% of people with SI joint, sacral torsion, sacral shear have thought about ending it. And of my patients, those 19 patients that I outlined in my sacral paper, and I wanted to make sure that I put that in there so people would understand that this is a real problem. Okay? And we have to screen for this, because if we don't screen for it, we're the mechanical experts, right? Everybody calls themselves some kind of expert in biomechanics. Well, are you? Are you screening for this? Because these people are screwed. You should see the crazy stories. I had somebody in here this week, 15 years of it. They're usually, by the time they get to me, I find they're $20,000 to $120,000 into it. Now, I had this patient that I saw 2-3 years ago. She had groin pain, buttock pain, back pain, right? And I don't take insurance, and she just didn't want to treat with me. Thought this was, some simple issue that any therapist could figure out, and, you should go use your insurance, you pay for it, right? And she came back like 2-3 years later, and she said, "I'm done with this. I'm ready for you to fix me." And I was like, what happened? And she said, "Well, I saw you 2-3 years ago. you got me out of pain. You told me what was wrong. And I've been to so many people since then. And she said the last therapy I went to for my groin pain, which is one of the most common referred pain patterns of SI joint, laughed at me. And I was like, yeah. And then I open up her SI joint, realign it, up slip, out flare, and boom, her groin pain's gone. I'm like, nah, it was SI. She goes, I'm done. I'm all done. I've spent more money than I would have spent going to you. So here I am. Let's do it. So she's about 50% better. We're about 3 weeks into it, 50% better. And she's happy. So, and she'll get better. So it makes me happy. Anyways, that's that. Make sure you screen things that don't show up on x-rays and MRIs. Go to Whelton Methods. YouTube, Spotify, all the social media channels, and have more in-depth things on YouTube, Spotify, and even Apple Podcasts. All right, and share, please share my papers. My papers. I've gotten messages from Nigeria. People are like, you don't know how many people's lives have been changed from those papers. Great, you know. So a lot of people can't take my courses. It's too much money, you know. I had one therapist from Bulgaria that said that it's like $2,000 to take a $300 course in US versus his currency. He saved up and took it. His clinic exploded, he told me. Really cool. Anyways, that's that. Peace. Love you all.